Hello everyone, this is Jonathan Marks from Go2Health Media. This is video 8 in our series How Project 2025 Will Change Healthcare in the United States. Project 2025 is the 920-page conservative agenda set by the Heritage Foundation to be implemented if and when former President Trump wins election in November 2024. You can see the complete list of videos we are producing in this evidence-based series. Our intent is to educate you with facts. We hope you will like our videos and subscribe to our channel. Today, we're focusing on the impact of Project 2025 on rural healthcare throughout the United States. Thanks in advance for your support. So you understand the issues surrounding rural healthcare and the implementation of Project 2025, let me share some facts about the nature of rural healthcare in the United States. First, according to the U.S. Census Bureau, 80% of the U.S. population lives in urban areas, while 20% lives in rural areas, so it's likely you're not familiar with the challenges of rural healthcare. We're discussing these challenges first, and then we'll let you know how Project 2025 will make this situation worse. First, according to the American Hospital Association, in rural areas, patients have to travel twice as far as in urban areas to reach a hospital or doctor's office. Healthcare is not just down the street, it can be 50 to 100 miles away. Second, rural areas have significant lower household income than urban areas. You'll see in this table from census.gov there is a 36% gap in income between urban and rural areas. That means there is lower disposable income and lower state tax revenues to fund healthcare expenses. It also means there are higher poverty rates and need for Medicaid in these portions of the country. Third, healthcare institutions and individual providers serving rural areas face financial challenges as well and need support. According to Saving Rural Hospitals, over 100 rural hospitals have closed in the past decade, and 30% of all rural hospitals in the U.S. are at risk of closing in the near future. It is difficult to recruit and retain providers in rural areas for these reasons. Fourth, we are all familiar with the trend toward telehealth and virtual visits. These technologies make our healthcare interactions more convenient and accessible. The challenge in rural areas is that broadband infrastructure is not built out completely and updates happen slowly. Fifth, needed services such as emergency rooms, labs, imaging are more expensive in rural areas because fewer patients are covering the high fixed costs of staff and equipment. So that's an overview of rural health challenges. Now let's understand how Project 2025 will make this situation more challenging. First, under Project 2025, as we covered in video 3, the Affordable Care Act will be cut back. This means less federal funding for states as needed for Medicaid, public health programs such as screening and vaccination, and surveillance of diseases, and less support of rural facilities. Second, cutbacks to Medicare and Medicaid under Project 2025, as we covered in video 5, will make healthcare less affordable for millions of Americans, especially in lower-income rural areas. This will affect red states more than blue states, as we covered in video 2, because red states have lower state household incomes and have not expanded Medicaid coverage to more households because the states can't afford it. Third, the deregulation of private health insurance, as we explained in video 4, will reduce the amount of covered procedures and raise the prices to enable more company profits, something the lower-income population of rural areas can't afford. Fourth, with the further closing of rural medical facilities due to reduced funding, more individuals will suffer from poorer health, engaging with the health system at times of emergency rather than prevention. This makes healthcare more costly and makes health outcomes much worse. In conclusion, while Project 2025 aims to reduce federal spending and increase state and private sector control over health care, the proposed changes carry significant risks. The reduction in federal support for Medicaid, the rollback of ACA provisions, deregulation of private insurance, cuts to preventive services, and reduced funding for rural health care and public health programs all threaten to diminish health care coverage for millions of Americans. Thank you for watching. We hope this video gives insight into how Project 2025 will change health care in the United States. Please like this video so more people see it. Thank you in advance. And please subscribe to our YouTube channel so you benefit from all the videos in this series. This has been Jonathan Marks with Go to Health Media.